Y'all gotta get with the program, champ. 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 Y'all gotta get with the 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 program, champ.
What's good?
I'm good. Trying to survive this COVID. I don't have it, which is the whole issue.
Hey, listen, we're going to survive. We're going to survive.
Yes,
People
we're fighters.
need us to survive.
We're New York fighters.
Huh?
We're New York fighters.
Absolutely. We definitely New York fighters. So how you doing today?
I'm doing pretty good. I'm taking care of some stuff. Anxious to get back to work, as a surgeon, even though doctors are essential. Surgery, plastic surgery, not necessarily essential to the governor, but essential to me and a lot of my patients.
Right, exactly. And a lot of the people that think about being your patients.
Yes, exactly. Especially now, it's hard. You're on Zoom, you're on FaceTime, social media, it's tricky.
Yeah, I know. That's why I created this, to stay in tune with my viewers and my followers and stuff like that. Because a lot of people don't want to come out and go to different locations. They don't feel comfortable. So right. I had to get to them some type of way, to keep the platform rolling and to keep the aspect of letting people be noticed going. Because I just do this to help people.
Oh, it's awesome.
Yeah. So you good today, huh?
Yeah, I'm taking care of some stuff, organizing.
Right.
I feel like that's all I do, but if you look around, nothing's as organized as I want it to be.
So let's talk about your career, Michelle. So how long you been in the business?
I started practice around 2001. I graduated from med school in 93. I'm board certified in general surgery, then did plastic surgery, fellowship and residency. So that was, about 8 years of residency after medicine.
Mm-hmm.
And I did my training pretty much all in New York, in Brooklyn, at downstate Kings County, and then went out to California for a fellowship in facelifting and eyes. And then I started my own practice, and I'm on Fifth Avenue, Manhattan, and
mm-hmm.
I do procedures in the office and surgery in the operating room. It's a nice mix. I do some necessary cancers, breast reconstruction, and then a lot of cosmetic. People want to look good. They want to feel good.
All right, so let me ask you a question. So when you grew up as a young girl, what did you want to be?
What did I want to be? I went through everything as younger. I wanted to be a teacher, geologist. I even wanted to be an astronaut at one point. I'm old enough to have been obsessed with the $6 million man. I wanted to be a lawyer for most of my junior high and high school, and then I had a nose job. I wake up from surgery and I decide I want to be a doctor and a plastic surgeon.
Right. So let me ask you a question. So a lot of people don't know all the accolades that you achieved and all the shows that you've been on with your walk. But before I get into that, so how many total years of schooling did you do?
Well, if you count college, it's 4 years of college, 4 years of med school, and 8 years of residency. So it's 16 years after high school.
Wow.
So everyone was out having, some fun. I had to be studying and working. But, I love it. I love what I do. It's a long road. But no matter what career people have, you have to work to get there.
Yes. And to be successful, you got to put that work in.
Definitely. And you have to keep working. If part of a doctor is educating future doctors and future generations, and also educating your patients. You know, I like what I like about social media. It's so educational that you could explain a procedure. If people have questions, they could email you, direct message, ask a question, type in a question. I mean, it's all great way of connecting, you know, with an audience.
Yes. So let me ask you a question. So what's your take, I'm gonna put it like that, on this COVID-19 pandemic situation that we live in?
Okay. I mean, at first, I was one of the people that's like, okay, it's a virus, it's a flu. Why are they shutting everything down? I remember I was surprised when the Louvre closed in Paris. I was surprised when all of a sudden, you know, the basketball was canceling and hockey was canceling. And there's this thing as a bad flu. I mean, in the U.S. now, anywhere from 30,000 to 80,000 people, unfortunately, succumb to the flu every year.
Right.
That things got bad in New York. It seemed to be more contagious, and it just hit so many people at once so fast. And when we saw what was going on in Italy, it kind of, you like, oh, that's Italy. That won't happen here in the United States. But when it's in your own city, and the governor's on, the mayor's on, they're complaining they're running out of supplies, they need more doctors, they need more equipment, then you know it's real. When you hear ambulances and you're, you know, high up in a high rise, you're like, why am I hearing ambulances? But now we're in a gray zone. You know, unfortunately, there's been huge loss of lives. The disease is contagious. There is not a vaccine. You know, a third of people are asymptomatic. And the rest of us are like, okay, we're wearing a mask, we're hand washing, we're keeping social distancing. And there's a certain fear, and then there's a certain like, okay, well, is it okay to go outside yet? Like, the flu season isn't 12 months. Flu season in New York's normally, they want vaccinations in October. Stops in like May. So the flu season isn't all year. And we were hoping, you know, how South America, they're just getting hit now. We were hoping that maybe it doesn't involve warm weather.
Right.
So, I mean, it's scary, but a part of me is like, I want to get back to work because my mental health isn't good. You know, as surgeons, we wear a mask all the time anyway. We wash our hands. We wear gloves.
Right.
You know, sometimes I'm in people's face so I can do what I have to do. And there are procedures like Botox and fillers that I used to not wear a mask for, but we will this point going forward.
Right.
I hate to date myself, but I'm old enough to remember when HIV and AIDS and all was getting started, and the whole universal precautions for medicine then, they just weren't wearing a mask and gloves.
Right.
And now on the standard of care. So, you know, within medicine, we're used to dealing with people that have diseases, contagious diseases, infectious diseases. And we're used to a certain risk, and we understand sterile technique. But society, I mean, there are friends I have and family members that are scared to leave their home, especially older people. And it's horrible living in fear, whether it's terrorist fear or health fear. It's scary.
Yes, yes.
You know, we fought strong. New York came back after September 11th. We came back after Hurricane Sandy. But that's a lot of hits, you know? Like, how many hits could we take?
Big hits. Major hits, you know?
And I read this article about people that were born, like, at the turn of the century, and I'm talking 1900. Like, they lived through the Spanish flu, World War I, World War II, Korean War. So, I mean, life isn't always simple. And that's why it's important to do things that you love for a living. And I feel good because I help people when I'm able to help people.
Right. Wow. So let me ask you a question. So a friend of mine asked me earlier, well, they got tested for the COVID-19.
Right.
And they were told that they were negative.
Right.
So negative means they never had it, correct?
No. Well, there's two parts of negative. There's two kinds of COVID testing.
Right.
There's COVID testing, the main category for PCR, and that's testing for the virus.
Right.
And usually that's the swab either into the nose or into the throat. they're doing more for the nose because it's a little lower risk to the healthcare provider testing.
Right.
But that has a false negative rate of almost 30%.
Wow.
So people could have COVID and still test negative. Then there's a thing called antibody testing. So the asymptomatic people, which is a third, and the people that had COVID and recovered, anywhere from 3 to 6 to 8 weeks later, our natural immune system builds up antibodies. Like chickenpox. Like when you were younger, we didn't have it. I didn't have a chickenpox vaccine. We got the chickenpox, and then you became immune to the chickenpox because your body developed antibodies.
Right.
So people are now going for antibody testing. Some of that is FDA approved. And that means if you had the virus and your body has antibodies to it, to hopefully, but not definitively, lower your risk of getting infected. So when people get a vaccine, the measles, say, or tetanus, your body builds up antibodies to fight those viruses.
Right. So what they were asking me was, being that the doctor told them they didn't catch it. They never had it since it happened. Is it better to never had it, or is it better to have it because you're not supposed to be able to get it again? That's the question.
Well, I mean, if you had it and you had no symptoms, or you had it and you had mild symptoms, then that's, then you should be at a lower risk of developing COVID a second time.
Right.
No, I think they were talking about in Asia that some people got it again, but I think that might have been an early relapse. Like if you had, like, say you had mono and you were sick and laid down, and then you decided to go to a party or the gym, and then the next day you feel sick again, you need some time for the body to recover.
Right.
Whether it's an infection, a trauma, a surgery, your body needs to heal, and that takes time.
Okay. So
I can't tell you if your friends had it or not. That I can't answer yet. But I'd wear a mask.
Yeah, me too. Listen, me personally, I don't think it's going to be over till next year. So that's my theory. I'm going to wear a mask all the time.
I think as far as a vaccination, I mean, it's going to take time, because even though there are some promising early results, they need to, test enough people to know that it works and that there are minimal side effects. Everything's a risk benefit.
Right. All right. So I just want to read something real quick about your career before we move on. It says in recent years, Dr. Zweifler, that's how you say it, right?
Yes, Dr. Zweifler, yes.
Has been featured in the New York Times, New York Magazine, New York Post, CNN, Fox News, Eyewitness News, WB11, CNN Headline News, and News One. That's a hell of a media presence you had, my friend.
Right. And yeah, it's definitely over the years. I used to, work with a dentist, and we did a lot of information. We were like, before the term Medi-Spa even really existed, I was injecting Botox in a dentist's office, not as a dentist, but as a plastic surgeon.
Right.
But the whole face, teeth all go together. We want to all look good.
Yes. So let's talk about plastic surgery right now. All right. So let's talk about injections. Can you explain to people what injections, what injections mean? What happens with an injection?
Okay, and we're talking injections. We're not talking vaccinations. We're done with that side.
Yeah, we finished with that life. We're talking plastic surgery now.
There's two basic categories of injections.
Right.
There's fillers and there's Botox and neurotoxins. So we'll start with the fillers. So fillers initially were just to treat like the folds here, the laugh lines. And what happens is, as we age, we lose collagen, we lose elasticity. Our full cheeks that, people always wanted to pinch, they come down. You get this and along here.
Right.
So today we use fillers, and products include Restylane, Juvederm, they're hyaluronic acid. There's newer products, Velour, Volbella, Sculptra, which you stimulate your own collagen, and Radiesse. And their goal is for some of them it's to lift, some of it's to fill and camouflage, and some of it's to give fullness to the lips.
Mm-hmm.
When people say their lips look too big or too full, it may be too much filler, but that's in right now. People want, it's youthful, lips are a sexual organ, and people like the
They definitely are.
right. Well, what we've seen over the years is that we're talking about lips. I mean, we do breast enhancement, so breasts get bigger. Now, Brazilian butt lifts or fat graft into the butt. Butts keep getting bigger. Well, lips are in that category. You know, people want their lips bigger, and you know, some of it's trend and time, and most of the fillers are reversible. So you get an instant result. You put the filler in, you see your cheeks, they're lifted. You have a poor jawline, you put some along the jawline. You have a line along your marionette lines, like you fill it. You have some wrinkles around the lips, you could fill it. It's an immediate result. The products last about 6 months. You could get a little bruising, some swelling, lumpiness. You know, we don't want any infections. But most patients are pretty happy.
Mm-hmm.
There's a thing called a liquid facelift. People really probably should have a facelift, but they get like 6 syringes, 8 syringes of filler so you could fill out all the fat that's lost.
Right.
Unfortunately, we age. And when we
Right.
age, we lose fat in good places, which are the cheeks. You
Right.
gain fat usually in bad places like the love handles or the flanks.
Right.
And so that's the filler side.
Uh-huh.
Then the other injections, we have Botox. And Botox could be Botox brand. It could be Dysport brand. They're the company that makes Restylane. It could be Zeman. It could be Jeuveau, #Newtox. And the neurotoxins are a series of injections, and they stop movement or they minimize movement in an area.
Mm-hmm.
Like notice I could barely frown. And you treat the frown lines because people get 11s along here. Botox also helps lift the eyebrows up. You could get rid of the crow's feet. I don't think I have crow's feet anymore. So you could get rid of the crow's feet. And so it does 2 things. It gets rid of lines in certain locations. You can treat it for the forehead. You could use Botox in the upper face to elevate the eyebrows to give eyebrow shaping. People that come to me asymmetric, like myself, I'm not completely symmetric. When you do injections, sometimes you make the asymmetry even more obvious, or you try to predict and try to lower one eyebrow if it's too high or raise the other one if it's too low. If you do too much Botox in the forehead to get rid of those deep, deep lines, you drop the eyebrows and the eyebrows get flat and people can look mean. You want some expression, and some people want frozen, and there's a fine line, you know, what works.
Right.
And that's Botox of the upper face. Botox also works for little lip wrinkles. It works to turn the corner of the mouth up. People grind their teeth. We are in a very stressful time in a stressed out city, and people grind their teeth. And we put Botox in the masseter. And that minimizes the grinding, but it also makes a face look a little more sunken in, so you have more cheekbone and a little more.
Right.
You could use Botox on the neck to get rid of wrinkles in the neck. So those Botox products are temporary. They last about 3 to 4 months. Bruising, sometimes people get a little headache, a little nausea. Rarely are people allergic to it, and sometimes dosing's not the same. The same way our muscles on our arms aren't the same on everybody. There's some variability, but you can always add a little bit more if you don't, if you didn't get enough of a result. You can't reverse it if you don't like it.
Okay.
But the fillers most people like. If you had a little problem or you thought your lips were too big, let the swelling go down, and you could always dissolve, some of the the products with hyaluronidase.
Right. So what about the breast implants?
Okay, well, we love breast implants. That's another instant gratification. Someone comes in, either they weren't genetically blessed with the breast they wanted, or they had kids and they breastfed, and the breasts that were fuller kind of came down with time. Or say someone was a little fuller, they lost weight with time, and after they lost weight, their breasts got deflated because breasts are glands, ducts, and fatty tissue. So what an implant does, I wish I had them with me. I'm not filming in my office, but
Right.
it's made from silicone on the outside. It's filled either with saline, which is IV salt water, or
Mm-hmm.
it's filled with silicone gel, and the implant goes into the body. Incisions can be made under the breast, like kind of where the bra strap is. They can be made around the nipple. It could be sometimes done under the armpit. I don't believe in doing the belly button. You're working too far away, and you want good symmetry afterwards.
Right.
And the implants can be placed either behind the pectoralis muscle or on top of the muscle.
Mm-hmm.
And the implants themselves, they're swollen at first, but they look good. You wake up, you have rest. You went to sleep for surgery, you didn't have rest, you wake up. It is instant gratification.
Right.
Unfortunately, they don't last forever. The same way your car breaks down, your refrigerator breaks down. You can't just go to a car lot. It means another surgery if they deflate or if they get hard. And sometimes an implant's not enough, that you need a breast lift, where you lift the breast tissue and the nipple back up into better position.
So once you start those procedures are for life now, pretty much.
Well, the implant, no, sometimes people want the implants removed. They gained weight when they got older. Their breasts might have gotten bigger after pregnancies and kids. They might have gotten smaller. Or they just decided that that's something they wanted when they were in their 20s. Now they're 50 years old. They just don't care about it. So some people remove implants. Some people remove implants because they find the implants heavy or painful, or so I tell patients, I wish it was like a once in a lifetime procedure. You have your implants, you're good, they're going to be perfect and everything is, but that's not the real world.
Wow.
People understand that there's a risk and a very high chance that they're going to require at least one more surgery. Plus, you still got to go for all the mammograms and all the other screening that women have to do normally. And the implants, they have to know that you have the implant so they could get special views, so you could get a good, breast examination with the mammogram and with the sonogram.
Okay, so let's move along. Let's go down to the liposuction, to the stomach area.
Okay. You know what? Liposuction is a great procedure if the patient is going to exercise and maintain their weight.
Right.
I get a workout. I love it. My arms, I call it liposuction arms. That's my biceps. Good work. It's good for my
Talk about it,
shoulders,
Michelle.
my
Let them know.
Okay, so you think of the body, and you have skin, then you have a little fat underneath. That's normal. You have muscle coating, muscle, and then you have organs.
Right.
We want to avoid the organs. You do not want to be near any organs.
So
with liposuction, you make small incisions. You put fluid in. And the fluid, again, is IV fluid. It has lidocaine, which is local anesthetic. It has epinephrine to minimize bruising and swelling. The fluid goes in. You could use an ultrasound to help melt some of the fat. I'm not really into any of the lasers or radio frequency. I'm into manually removing the fat. I usually use either a combination of ultrasound vaser or power-assisted liposuction. The fat comes out with the fluid. So you finish surgery, it looks good. But the body knows that there was surgery. It's a little bit of a trauma, so there's some swelling. They have patients wear a garment. The swelling comes down at 1 week. It keeps coming 2 weeks. You look better at 3 weeks. You look better at 6 weeks. It really takes 6 months for things to soften up and to see more of the final result. But liposuction isn't a pass to go out and forget about exercising and eat unhealthy. It's part of, looking good and feeling good includes your diet, not just my liposuction.
Right.
And lipo's great because you could take that fat, and that fat could go a little bit into your cheeks if you lost fat there. The fat could go a little bit into your breast to add volume. It's not going to be as big as an implant, but it could hide sometimes an implant edge that may be a little visible.
Okay.
Or if you remove implants or you don't really want implants, you can put a little fat in the breast to give some volume, help maybe a little cleavage or a little upper pole fullness. It's not going to get you up really, half a cup size, at best a cup size. It's not going to give you a huge increase, but it's another option. And that liposuction fat could go into your butt and give you a Brazilian butt lift or BBL to give volume and shape to the butt and the hip region.
Yeah, we were talking. I was going to talk about that too. So let me ask you a question: is there a difference with a tummy tuck?
Yes. So tummy tuck, you're actually doing a couple things. You're removing the extra skin. So in lipo, we depended on time and good skin quality to contract the skin. So
Mm-hmm.
someone that has a lot of stretch marks or tears in their dermis from pregnancy or recent weight gain or rapid weight gain, they have this extra sagging skin. Laser's not going to do enough. Lipo's not necessarily going to do enough. That you have to remove it. And with the tummy tuck, you kind of usually have an incision that goes hip to hip in the pubic area. So it's like a C-section scar, double, triple the size of it to get out the extra skin. There's an incision above the belly button. So the skin above the belly button to the pubic area is all removed. Everything is freed up. The muscles, I usually was sitting up. The rectus muscles that go up and down separate as we get pregnant or older or gain weight. We
Right.
tighten the muscles up. So that's giving a tighter stomach. So it's pressing the muscles, the extra skin. You're removing the fat under the skin. Plus, you could do liposuction to help get rid of the extra fat at the same time.
Wow.
It's really part of a mommy makeover, a tummy tuck, as is, a breast implant, breast lift, even a breast reduction can be part of the mommy makeover. A tummy tuck's a bigger procedure, but it really that's why patients usually have to be examined so you can tell the difference of what they need. Do they need a tummy tuck or are they okay with?
Yeah, it makes
Nobody
sense.
wants scars, but sometimes no one wants extra skin either. So it's a trade-off.
It's a trade-off, huh?
Yeah, and you usually try to get a history and look at people's scars. Unfortunately, there are people that are susceptible to keloids, and no matter how well you stitch it up and all the scar therapies, some people still will develop keloids that may require injections and other treatments and lasers, but it is a problem with incisions. That's where lipo is so good. But you both have some downtime and some recovery.
Mm. So, all right, so let's move it right along. How about the Buttocks Lift?
Okay, well, the BBL is just fat, and you're making some small incisions from the fat that you did liposuction, and you're putting volume, either giving more projection going out or making a little bit wider. That's a BBL or Brazilian butt lift, fat grafting to the butt. But there's also a butt lift where you're actually removing extra skin. It's almost like a tummy tuck for the back where you're taking out skin to lift the butt up.
Mm-hmm.
That's usually done in people that lost a lot of weight or a lot of older patients.
Mm-hmm.
And sometimes you make an incision under the butt in the butt crease if there's a lot of extra skin in the butt sagging down. But more commonly, it's done with fat. There are patients that have no fat and they have no butt and they just want some volume. And the same way there's breast implants, there's solid silicone implants that could be placed in to the butt for gluteal enhancement.
Can I ask you a question? Do you have like a how I'm going to say this, like a machine or something on the computer where you can show them how you can look once the procedure is done?
Yeah, I don't believe in the digital software, but I do have a lot of colleagues that do that. I usually show my patients before and afters of my patients. I like to examine people. We know, you look at social media, some people look so different on the regular pictures of what you could do with a computer.
Mm-hmm.
That's not flesh.
Yeah, that's true.
It's not always realistic.
Right.
And a lot of people like to see their nose that way, but you can't necessarily guarantee that result no matter how talented you are. Some people's skin, muscle, bone just doesn't behave exactly as you want it to.
Yeah. That's why I wanted to speak to you, because I know you're going to give them the real story.
Yeah. There's no sugarcoating here.
Yeah. You know what I'm saying, Michelle? So let me ask you a question. So what about a female? I've seen a lot of females who got the BBLs, right?
Yeah.
And their butt look big, but their legs look small.
Well, sometimes the volume is added to the side. Like sometimes people will add the fat to the side of the hips.
Mm-hmm.
But for the butt to look big, the fat had to come from somewhere.
Right.
So when I started doing, it wasn't even called BBLs. When I started doing fat grafting to the butt, we were putting in 250 cc's a side, 300 cc's a side. Then it started going up to 500, 600. I mean, now people are getting 1.5 liters. So think of like when you think of a bottle of soda, a 2-liter bottle of Coke or 1-liter bottle of Coke. That's a lot of volume that's going in. So when you remove the fat from liposuction, you almost have to remove way more fat than actually is going to be able to go back in, because remember, it's mixed with some of the fluid.
Right.
So you're taking fat usually from the waist, you're taking fat from the abdomen, the back, the arms, and sometimes you have to take fat from the legs so you have enough volume. If you're going to put if you're going to put back in 2 liters, you might need to remove 3.5 liters to be able to put in 1 liter on each side. And when you do fat grafting, not all the fat lives. About 1/3 of the fat, takes, maybe half the fat lives. It's not 100% survival. So when they show these pictures on the OR table of everyone's butts being so big, some of that goes away with time. Some of that swelling and some of that fat reabsorbs.
Right. So will exercise like enhance it and keep it nice?
Yeah, squats are great. I mean, I personally work out about 5 days a week. I think you have to, do that. You want to keep your skin tone in good shape. You want to use sunblock, avoid being in the sun, use retinoids on the face. But for your butt, yes, squats are going to definitely help. And, different kind of lunges are going to help with your legs. You do have to do some work. I mean, it's called working out. There's a lot you could do in plastic surgery, but you need to be realistic.
So in the last 10 years, do you feel that the plastic surgery business, far as financially, has increased?
No, I think there's probably more demand on certain things because people look at themselves, they're taking selfies now, they're on Zoom meetings. I feel like social media, I hate to use the phrase keeping up with the Kardashians,
right.
But that is, I think, the name of their show. But people see how other people are transformed. But we don't know who's photoshopped and who's real, but we see transformed and stuff. So, I mean, we all want to look our best. We should be happy with who we are. But if we can make something a little better, I'm all for it,
Yeah, nothing wrong with that. I tell people all the time, as long as it looks good, it is what it is,
Right. But then there's always that beauty is in the eye of its beholder. So some people, go overboard. They want bigger breasts, bigger lips, bigger butts. And so, yes, they may be disproportionate to the rest of their body, but how one defines beauty, yes, there are cultural standards, but it's an individual thing. We don't all like the same piece of art. We don't all have the same taste of beauty of a person. That's what's unique.
Right. So what happens with the nose shaping procedure? How does that work?
No, now that's hard surgery. It's hard because you don't really have that much room to work. And everything you change is in a matter of millimeters. When you're changing breasts, you're changing centimeters. You're changing waist, you're changing inches. But here you have less room. The nose is a couple parts. Most of the incisions are done in the nose, sometimes a little incision underneath. And if there's a hump, like I had a big hump when I was younger, that gets shaved down. The nose gets, the bones get broken and get repositioned. People may want some more tip definition, so you can make the nose narrower. If your nose is missing or sunken in, what we call saddle nose, you may need a graft, maybe sometimes some cartilage or septum or even rib to make your nose stronger. There's synthetic. But, everyone has different desires for their nose of what they want. Nose takes a while for the swelling to go down. It takes, again, 6 months to a year to see the final results.
Wow.
The cast helps shape it and protect it. You can't do any contact sports right away. With all surgery, there's some restriction early on activity. But the nose is there so you can breathe. So, you want to be able to breathe after surgery. So you don't want to look like Michael Jackson, because I don't think he could breathe through that nose. There was no way when he was alive that he was able to breathe through that. Maybe that's why he couldn't breathe.
His sister's like that too. Not Janet, the other one.
They look like the same person. No, it's Janet Jackson.
Yeah, her nose was like that too. Yeah, it was. Yeah, the nostrils were really.
The purpose of the nose is breathing.
Yes.
And, there's no data to suggest anything with COVID, big nose, small nose. There's nothing with COVID and nose size. We haven't seen any information on that. But
Yeah.
you do need an airway that works.
So I can imagine there's pain, a lot of pain after each surgery, but I know the nose got to be one of the worst because it's a delicate area, right? The tissue, maybe?
It's a the cartilage isn't that part. When people break their nose, it's the swelling that hurts. It's a swelling of the nose. The bruising causes pain. The cast, the splint, it kind of keeps it confined. When I had my nose job, they put packing up my nose. We don't really do that much now. And the packing coming out, that was one of the worst things. But, today, the recovery from a nose isn't as bad. The procedures there's a saying, when you go to the gym, it's like no pain, no gain. It's the same thing with surgery. I mean, you're going to have some,
right.
Like a tummy tuck, you tighten the muscle. I tell the patients it's like 1,000,000 sit-ups. Liposuction hurts for a couple of days. Breast implants, it's like doing 1,000,000 push-ups if you're going behind the muscle.
Right.
Implants on top of the muscle. A breast reduction, women wake up, their back feels good, their breasts barely hurt. They feel like it's like a period cramp. So it really depends on the procedure. Pain's still variable too. Like some people think things are so painful, and other people are like, oh, not so bad.
So what is a thigh lift? I didn't know about thigh lifts. I saw something about that.
Okay, well, there's different parts. You could do liposuction of the thighs, and you could do, people's thighs touch in the middle. You could do liposuction the inner thigh. If they had salad bags, the outer thigh, the front of the thigh. So you could reduce the volume with liposuction. But some people lose a lot of weight, or they're aging, they have sagging skin, and you do a thigh lift. So you could try to hide the incision in what we call the groin crease. That's kind of where the underwear crease is. But some people have a lot of extra skin, and they almost need, like when you think of your jeans, how there's like a seam in the middle. Sometimes an incision has to go into the middle if people lost a lot of weight. But thigh lifts are probably one of the less popular procedures. Arm lifts, when you have I'm trying to do like you have the wings down. That could sometimes be done with an incision in the arm crease to lift the skin this way if it's just a little sagging. Or the weight loss patient, sometimes the scar goes longer. Sometimes you lipo here and just pull the skin this way. Right, you see, that's how he's lifting.
Yeah.
Arm lift is way more common than a thigh lift.
Right. A lot of women carry that weight on their arm. I'm a trainer also.
Yeah.
I'm a master trainer also. So, and I've trained a lot of women who, after surgery, keep their body, tight and all that type of stuff. And the arms are one of the biggest things that women want to get rid of, that fat back there,
So the craziest thing is, so the arm lifts, if you could do an incision underneath, great. I do this thing called an elbow lift. It's crazy, but true. So people get the wrinkles, above the elbow. They get, lines and creases. And, one line, some of these people have 8 rows, 7 rows, and it really bothers them. They're fit women. They exercise. They're in great shape. They're thin. They might have had a couple of plastic surgeries, like a facelift or a tummy tuck. They've had other things, and they want to look good, and they're wearing a short sleeve shirt. They look down at the arms, and they see these lines going across. And I'm like, listen, an elbow lift, I take out the little outer part of the skin. So instead of having 8 rows of wrinkles, you have 1 scar there. And it looks pretty good, actually. And the patients are happy. The problem is, these are people that exercise a lot, and you're telling them you can't move your elbows. I'm putting splints on them, and they can't move. So it has some complications. Everything has a little bit of a risk. But I enjoy the elbow lift. It's something a little wacky, but it works. It gets rid of just the little epidermis. It's the same technique I use when I do a breast lift. You're getting rid of the outer part of the skin to lift and remove excess tissue.
All right, so men. I know men come to see you too.
Of course men come to see me. Gynecomastia, man boobs, male breast reduction. Male breast reduction is pretty common. It's sad. I mean, most of the time we don't know what causes men to have gynecomastia. It's what we call idiopathic. Sometimes it can be related to medications or smoking pot or too much alcohol, but most of the time it's idiopathic or just excess weight. And that can be treated with liposuction a lot of the times, or sometimes men, need the breast tissue removed directly. But most of the time, liposuction. If it's a massive weight loss patient, you sometimes need to take some extra skin. We don't just limit liposuction to the breasts for men, but yes, men, no one likes love handles. I don't even know why they're called love handles. No one loves love handles.
Yeah, and I say the same thing. What about men get abs and stuff too, and stuff like that, right?
Yes. Well, men have two things though. Remember I was talking before a little bit about anatomy, how you have the outer skin, the subcutaneous fat, and then you have the muscles, and then you have the organs. Yeah. Well, the organs, that intra-abdominal fat is what men have more. So that fat does not work with liposuction. That intra-abdominal fat is only with weight loss, from dieting, in extreme cases, weight loss surgery. But it's a subcutaneous fat. So that pinchable fat, yes, men could have liposuction. People do abdominal etching. There's also fat grafting. I have colleagues that like to take fat and then make biceps, make deltoids, make some pectoralis definition. The problem with fat, whether it's put in the face, the butt, the breast, the deltoids, wherever you're going to put it, if you gain weight, that fat's going to get bigger. That fat's going to behave like the donor site where it came from. So, if you normally gain weight in your belly and you're putting belly fat, in your face, if you're going to gain 50 pounds, your face is going to get fatter. But men get other things too. Men get nose jobs, going back to noses. And the procedure we didn't talk before that bother men and women are eyelids. As we age, we get some extra skin. Gravity kind of comes down. We lose some fat along the upper eyelid. So men like their eyelids cleans up, or what we call blepharoplasty.
Let me ask you a funny question. And I know our viewers probably going to get a laugh out there because I just thought of this, right? Being that we talking about us. Do men go get the BBLs too?
They go what?
BBLs.
Yes, some men do. My patient population, not that many men have asked for it, but I have colleagues that specialize and only do BBL. And I have some colleagues that specialize more in male patients only. I love everything. So I know people will use that horrible phrase, jack of all trades, master of none. I don't believe that. I love a lot of facets of what I do, and I don't want to give certain procedures up. I don't do rhinoplasty, but I don't only want to do male plastic surgery or female plastic surgery. I like both. I like diversity.
Right. Yeah, there's nothing wrong with that because I'm a master trainer. I have no limits to what I do as far as training. I could train little kids. I could train people in between being a little kid and senior. So there's no jack of all trades and master. None of it just means that you're good at a lot of stuff. Yes. Bottom line. You know what I mean?
And also going back to people that lose a lot of weight, sometimes men even get tummy tucks, So some of the procedures you can't say are only women or only men. I don't want to get into the topic now, but there's a whole other field of plastic surgery called gender reassignment surgery. And I don't specialize in that. That I leave for people that, that specialize where, there's different procedures, and that is out of my scope of discussion for that.
I hear you. But listen, so what's your consultations and second opinion procedure?
They do a lot of revisional breast surgery. People that had breast implants before and either want to go bigger, they want to go smaller, maybe they need their implants replaced, they want a breast lift with that. So that's a lot of revisional breast surgery. As I said earlier, one of the hardest procedures in all plastic surgery are rhinoplasties. That I usually refer out for very complicated cases. Even most rhinoplasties, that is not what I do. But my fellowship, I did an extra year in facelifting and eyes, and that's something I really enjoy. People want to look their best, not just today, but they want to go back. I thought I looked really good when 10, 15 years ago, and people want to go back. We eat healthy. We live longer. We take care of ourselves. You want to look as good as you feel inside. And I enjoy that as a primary procedure or as a secondary procedure, as a second consult or as a primary.
Okay. So your consultations, are they free?
I normally I do charge a consultation fee.
Uh-huh.
With what's going on with COVID-19, and I think I've been offering virtual consultation for free, complimentary. I don't like the word free. And I figured
Okay.
through the summer, I'm going to be doing complimentary consultations because we're all in this together, as they say on the news. And people want information, and I want to educate patients. And yes, I want to operate. I want to get back to business as usual. But I do want to offer my services and be sympathetic over people's finances now more than ever.
I got you. So what does facial rejuvenation consist of?
Well, it could be something like we talked about earlier about injections, Botox, and fillers.
Mm-hmm.
But most, it could be a chemical peel. I don't perform lasers. I'm a big fan of TCA peels. They help get rid of the outer skin, the epidermis, go into the dermis, stimulate new collagen. There's downtime, but I happen to like it. I find it's good getting rid of some pre-malignant or even early skin cancers. And then there's facial rejuvenation, including the surgical aspect. So as we started talking about before, that was my niece. She wanted me to go help her with her
Yes, my
homework.
trying to call.
I
Yeah,
told her I was going to be on Instagram Live. She should be watching me, not calling me.
yeah. Tell her we shine. It's your moment to shine right now. Take it easy.
Facial rejuvenation. So I include in that, it's usually a facelift. And with the facelift, the incisions kind of go around the hairline, around the ear, coming back up. And you're repositioning the skin. You're tightening the muscle coating, or what's called the smaz. You may be adding fat grafting. You're removing the extra skin.
Mm-hmm.
Same thing with the eyes and the upper eyelids. You're removing extra skin, maybe a little strip of muscle. On the lower eyelids, you're either taking skin, sometimes some extra fatty tissue. A peel may be done at the same time. Dermabrasion at the same time if there's wrinkles around the mouth, or even if there's deep wrinkles in between the eyebrows, or we call the glabellar region.
Mm-hmm.
Facial rejuvenation really is restoring your neck contour.
Okay.
Getting your eyebrows back into position, getting your eyelids to look more youthful. Sometimes the eyelids pull down. You might need a little tightening procedure, what we call a canthopexy. Right. So rejuvenation is turning that all back. At home,
works with the bags too, right?
Yeah, the bags under the eyes. Yeah. That's, each thing, we all age together. The same face got sun at the same time. We're losing collagen, we're losing elasticity. Sunblock, water, retin A, important, home maintenance. That's the minimum people do for prevention. But, and see your dermatologist, make sure your skin's in good shape too. I have to call. But
that's okay.
You want facial harmony. So you want everything to look good because everything ages together. So if you just fix your lower eyelid and you don't take care of your sagging face, no one's going to notice a difference. You might not even notice a difference. So sometimes you need to lift up the cheek to help the lower eyelids look better. And rest things all at once. And that's, facial harmony and part of the facial rejuvenation process.
Just want to ask you a quick question before we go, right? Lil' Kim is like one of my favorite rappers, female rappers. And I remember when she first started getting stuff done to her face and stuff like that. It looked like somewhere along the lines, it got carried away, or she got carried away, and she doesn't look like herself anymore.
Correct.
Did you have an idea what might have happened with her?
From her face perspective,
yeah,
I just think she might have been overfilled, and she's had probably her nose job. I had a rhinoplasty. Yes, I don't always recognize her in some current pictures. The fillers that are from hyaluronic acid that's put in people's lips, like the Restylane, the Juvederms, the Volbellas, the Velours, that stuff is reversible. So if all of a sudden she decides that she has too much in her lips, that could be dissolved with Hylenex or hyaluronidase.
Hmm.
I don't know what she's done. She's not my patient, and I can't only speculate. But she does look exceedingly different today than she used to. And as I said earlier, the beauty is in the eye of the beholder. Maybe that might be what she wants.
Wow.
I don't know if it was, things that didn't go the way she wanted, or was that her request. But the problem is, we all see ourselves differently. Like,
Hmm.
we are our own worst critics. So she may look in the mirror and that may bother her. Or you fix
Right.
one thing and you're like, oh no, now this bothers me. I mean, that's how I feel sometimes. I fix something like, oh wait, this now bothers me. Why do so you just don't know. Was it her doctor? Was it her? Was it maybe her publicist? Maybe, she needs glasses and
Hmm.
can't see how they look. Who knows? But
Right, right.
and being under public scrutiny, sometimes people do it just to get their name out there. I don't know if they do things just for attention. Like
Yeah,
getting
yeah.
married, getting divorced, and having a baby. Sometimes I think those are business decisions for. I don't know what celebrities sometimes are thinking. Was that really what what you wanted to do?
Yeah, it's true. So can you tell everybody your social media links, just in case they might need some of your services?
Okay, well, on Instagram, it's at Dr. Michelle Zweifler. It's a long one, Michelle, Michelle, and Zweifler, Zweifler. Even if you spell it wrong, I'm sure I'd show up, because I think I'm the only one in the world, for better, for worse.
Uh-huh.
I'm unique in that way. It's not a common name.
Uh-huh. I
And
got you.
I go into the same thing for my website as well as for my Facebook business account. And I'm always available for any direct messaging, or you could always give me a call, shout out, 212-355-0500. But
Right.
I'm around. You can email me. I mean, I'm extra around now, because even though doctors are essential, we're not really totally essential, but hopefully we'll get back to operating and doing the procedures that we all enjoy.
Yes.
Yeah.
So Michelle, thank you very much
And go
for coming to my
Yankees.
show.
Thanks for
Yeah,
having
you
me.
see, I'm ready for the season, right? Plus, I
Listen,
need a
my
haircut too. I
hair's
haven't had a
ready for a
haircut.
Yankee cap too. I should put one on myself.
So I had to invest in some Yankee hats to hold me down for a little while. But like I said, thank you for coming to the show.
Thanks for having me.
And I'll definitely be in touch.
Cool.
And you have a wonderful day.
Thanks.
And somewhere along the lines, we'll bump into each other when this stuff is all over.
Sounds good. Thank you. Stay
You're
well,
welcome. You have
everyone.
a
Keep
wonderful day.
safe. I love New York.
Hey, real quick, do you clap at 7 o'clock like everybody?
Of course, I open up my window. I'm always afraid I'm going to fall out because I don't have those toilet bars. But yeah, I open up my window every day. I sometimes swing by Lenox Hill Hospital and I go outside. I do feel a
Yeah.
little guilty that I'm not working, but that's not my area of expertise. My expertise are not infectious disease or COVID or ICU
Yeah.
matter.
Right. Well, it was an honor and a pleasure to have you on the show.
Thank you, and
Once
thanks
again,
everyone that joins. Stay healthy, and I'm here for you. Take care.
you have a great day. Talk to
You
you soon. All right, bye-bye.
Y'all gotta get with the program, champ. 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 Y'all gotta get with the 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 program, champ.